And thank you for joining us today. We know everybody has busy schedules full of Zoom meetings, so we appreciate that you're here with us today. My name is Marla Castaneda. I'm the Community Outreach and Engagement Coordinator for UC San Diego's Center for Better Beginnings. MotherToBaby California is an information service that connects experts in the field of birth defects with moms-to-be and the general public. So we're a program of the Center for Better Beginnings, which is a division of the Department of Pediatrics here at UC San Diego. And MotherToBaby is actually a suggested resource by the Centers for Disease Control and Prevention, and also by the U.S. Food and Drug Administration Office of Women's Health. So you'll find us as a suggested resource on their websites. So as far as our leadership and our history, so we were established over 40 years ago at UC San Diego School of Medicine. And MotherToBaby is funded by the State of California Department of Education. And we're led by world-renowned birth defects experts. You can see here Dr. Ken Lyons-Jones. He's the medical director and a professor of pediatrics at UC San Diego. And also Dr. Christina Chambers, who's our program director and also professor of pediatrics at UC San Diego. And our staff, we have some of our staff members here. But they offer an added layer of support by giving individualized risk assessments on exposures during pregnancy or while breastfeeding, with the goal of reducing the risk of birth defects and improving maternal and child health. So it's not only for moms that are already pregnant or breastfeeding, but if someone's thinking about becoming pregnant and may have a chronic health condition and might have some questions before becoming pregnant. And also providing information to providers or community organizations who work with pregnant and breastfeeding moms. So the big question is, what's the impact of medications, vaccines, infections, recreational drugs, workplace exposures on the developing baby? So regional expertise and national network of affiliates. So MotherToBaby California is an affiliate of the nonprofit organization of Teratology Information Specialists, or OTIS, which is a professional society that supports and contributes to worldwide initiatives for teratology education and research. So MotherToBaby California, actually, we get calls routed from other states as well. So we'll take calls that they come from Alaska, Hawaii, Idaho, Montana, Nevada, Oregon, Washington, the U.S. territories of American Samoa, Guam, and the Northern Mariana Islands, and Puerto Rico, and the U.S. Virgin Islands. So what happens is when someone calls in, they'll get routed to the appropriate affiliate depending on their area code. So MotherToBaby is across the United States, just depending on where the person is actually calling from, they'll get routed to the correct affiliate. So some key points about our services. It's free and confidential, so there's absolutely no cost to use the services. We don't require any insurance or social security number. It's available in a variety of remote ways, which for today's situation that we're living is great. It's available by phone, by email, or by live chat. So when people log into the website, a chat will pop up, and actually we'll talk a little bit more about our website a little bit. But if someone's available, they can chat right then and there with the person directly. And like I said, they can also just give us a call or an email. No appointment required, so it's not something that has to be set up beforehand. It's bilingual staff, so available currently in English and Spanish. Like I mentioned, no insurance, no social security number needed. It also offers participants the opportunity to be referred to the MotherToBaby pregnancy studies, which are observational pregnancy studies about exposures to medications or vaccines.
So an exposure is any agent that a pregnant woman is exposed to that can increase the chance or the risk of having a baby with a birth defect. So an exposure can be a chemical, it could be an infection, it could be maybe a supplement, it could be some herbal agent, it could be some external exposure that the woman has that could increase the risk of having some adverse pregnancy outcome. So in our counseling, when we talk to pregnant women or women that are planning pregnancies, we talk to them about what exposures they're concerned about, whether they be exposures that are from a medical condition, like an infection or a disease, or maybe they're concerned about the medications that they take, their workplace exposures, or maybe travel. Travel is not something that we're doing right now, but this pandemic won't last forever. And, before the pandemic, travel actually was an important question to our service because of the Zika infection. As many of you may know, that Zika is associated with a higher chance of having a baby with a birth defect if the woman is infected during pregnancy. So this was actually an important question to our service, an important question the women had who were planning pregnancy or who were pregnant and traveling. So this, even though we're in the midst of this pandemic now, once this becomes more settled because of vaccines, then I'm confident the Zika question will come back again. So again, there are exposures that are known to increase the risk for birth defects, and those exposures are called teratogens. And so those teratogens are identified through studies. So studies that find a dose response, a pattern of birth defects usually, and of course a higher risk over the normal general population risk of 3 to 5%. So what do we use? What tools do we use when we counsel women and that are either pregnant or breastfeeding? So these are a sample of the resources that we use. We use PubMed because we look for the latest studies. We use Reprotox and Terrace. Reprotox and Terrace are updated on a regular basis, but it might be yearly because they have like so many thousands of listings on their websites. So on their databases. So we you utilize PubMed to do searches for maybe the latest information, just in case there's been any change to the latest available on Reprotox or Terrace. And we use LactMed also for lactation information. And we're so happy that we count on the expertise of the people at Reprotox and Terrace and LactMed. We have them available to us if there is a question that we can't answer through these websites. We actually have direct contact with them because some of them serve on our advisory board, and they're available to us, when we need them. So not only do we count on the databases, but we count on their expertise as well for individual counseling. So alcohol is still the leading cause of neurodevelopmental disability, preventable neurodevelopmental disability in children. Studies suggest that really it's underdiagnosed, and it's as common, as prevalent as autism spectrum disorders. So this is a source of great concern to us. It's something that we obviously question all pregnant women about. We ask them about their alcohol use during pregnancy, and we counsel them on the importance of avoiding it completely during pregnancy to prevent birth defects associated with alcohol consumption. And the risk with alcohol use in pregnancy is fetal alcohol spectrum disorders, which primarily the major effect is to the brain. The effects may be more minor, they may be severe, meaning an IQ less than 70, but there is a great concern, and the risk appears to be dose effective, or there appears to be a dose response. But there are other factors, genetic factors, that contribute to the risk of a baby having alcohol. There's age, alcohol-related birth defects, including the mom's age, genetics of the mother and the baby, and maybe nutritional factors as well. Thanks. We counsel women about workplace exposures. Women that are pregnant and working in hospitals, clinics, dental facilities, nail salons, give us a call. They ask us about their exposures. In the case of healthcare providers and dental technicians, a lot of it has to do with radiation. What are the radiation limits for pregnant women, pregnant workers? So a lot of it involves us researching what the limits are for those workers, those pregnant workers. Some of it may be for women that work in nail salons. What is the size of the facility where they work? Are they working alone in a facility, or are they working with 30 other women, and there are they're working all 10 hours a day, 11 hours a day? So a lot of that we do with workplace exposures is very individual to the women, always using, of course, any resources that are available from the CDC, from from OSHA and any other, available information. Prescription and over-the-counter medications, obviously really important to pregnant women that we know more um, about prescription over-the-counter medicines, the use in pregnancy. Unfortunately, most medications have not been studied in pregnancy, or the information is really poor. And so it's very concerning to all of us. Most women will take at least one medication, and even prenatal vitamins, which we do get a lot of calls about prenatal vitamins. You'd be surprised, how many of them either don't contain the recommended levels of vitamins for pregnant women, or they contain excess amounts of vitamins, or they contain herbal agents or other agents that, in fact, are not recommended by the National Institutes of Health for pregnant women. So, herbal, extra, caffeine, even just things that have not been studied and are not recommended for prenatal vitamins. So the lack of regulation even on prenatal vitamins and supplements is a concern for pregnant women, and certainly for us. And we get calls about, lots of over-the-counter medicines, sometimes related to COVID, sometimes related to cold infections during this time, and of course throughout the year. Probably our leading call regarding prescription medications, whether it's on chat or on the phone, is going to be antidepressants, maybe atypical antipsychotics. That's usually the most frequent prescription call. And then for over-the-counter medicines, it's probably going to be pain medicines and fever-reducing medicines. So regarding infections and vaccines, obviously, really important at this time with the pandemic. Lots of women giving us calls about prevention. As you know, there's a lot of misinformation out there about, preventing COVID. Lots of women giving us calls about taking zinc and vitamin C, which of course is not recommended. There's just no evidence that taking zinc or vitamin C protects you from either getting COVID or preventing COVID infection. But we still get a lot of calls about this. We get questions on chat, questions on the phone about it. So it's important to us to disseminate information that's evidence-based about preventing infections and utilizing vaccines when appropriate, either pre-pregnancy or during pregnancy, to prevent adverse effects during the pregnancy. So one of the things we always do come around August, September, is we ask all pregnant women about the flu shot, and we talk to them about the importance of getting flu shot. Every August, September, we start that, and we end about March, because that's about the end of the major flu season. So between about August, September through March, we ask all women that are pregnant if they've had their flu shot. If they've not, we talk to them about the importance of getting their flu shot, and we ask them to ask their doctor to give them their flu shot. So we are very positive on getting flu shots, and it's important to us to disseminate the benefits to pregnant women. Of course, COVID, the pandemic, we can't escape it. It's something that we all have to deal with, made a huge impact on all of our lives. And of course, no different for pregnant women and breastfeeding moms who are very concerned about the infection during pregnancy or while they're breastfeeding. Fortunately, we have lots of information on our website that women can access and that healthcare providers can access, whether in the form of a podcast, whether in the form of the fact sheets or the blog articles that we put up. When you go to the website and you put in on the search field, COVID-19, it comes up with a number of options for you. And if you click on one of them, it also gives you other options for other searches that may be of interest. So if you're looking up COVID-19, acetaminophen will also come up suggested to you, because that may be something you're interested in learning about. So important at this time that pregnant women and breastfeeding moms get up-to-date information about the risks of COVID-19 and pregnancy. One of the latest studies that came out just in the past week, it's in suggested that, or found that their infants born to women who had COVID during pregnancy did have antibodies against the infection, which this is something that a lot of women have been asking about. And we don't know from the study how long the baby would benefit from those antibodies, whether it would be 5 months or 3 months or 6 months. But the evidence does suggest that babies born to women who have the infection do have some protection. And that study suggested that the severity of the illness was associated more strongly with providing that protection. So if women had more severe symptoms during pregnancy of COVID, their babies were more likely to have protection against COVID, which was an interesting finding. So what do we tell women about the importance of COVID-19 in terms of safety and breastfeeding? So, we like to keep it simple because women are receiving so many messages through that are wrong, frankly, through, Facebook and, emails and just friends that are well-intentioned maybe. But we like to keep it simple. So the importance of hand washing and social distancing and wearing the mask, above everything else is so important. And for breastfeeding moms, again, also washing the hands and following the CDC recommendations. If they're, using pumping breast milk out, for example, to save for later, to following those recommendations regarding storage and proper pumping. And of course, always wearing their mask. So important to prevent bringing the infection home and possibly infecting their babies. Go ahead. So what you need to know about COVID-19, so that, the information is still emerging. The available data, so here we are about, 1 year out. And so the available data has not found an increased risk for birth defects. That means that if there's a risk, it's probably pretty low for birth defects, because at 1 year out, a pattern of birth defects has not been identified, an increased risk has not been identified, which means that if there's a risk, again, it's probably pretty low. If there's a risk, it's probably from the fever. And of course, it's so important that women know to treat a fever when they get it in pregnancy, regardless of the trimester, and to use, the medication that their doctor has recommended, which is probably acetaminophen, for fever control. Studies that are limited but suggest maybe a higher risk for prematurity. And, that kind of makes sense, especially if it's later in the pregnancy, that a premature delivery might be the highest concern at that point. So again, going back to what we can provide, is just the latest information. For example, the study I just mentioned to you was something that we will be bringing up with women that have the infection and are concerned and are contacting us. We would be sharing that with their healthcare providers. It's something that when we learn something, we disseminate it amongst all the counselors so that we're all up to date, whether we're on chat or on the phone, that we're able to disseminate this information as quickly as possible. Always keeping in mind that emerging data is not the final word. It's always a matter of building on top of our knowledge. What we know today may change a little bit tomorrow based on emerging data, but it's so important that we know what we understand and that we're able to disseminate the best information. So about the vaccines, it's what we're telling women is that the evidence at this point does not suggest that getting vaccinated during pregnancy or while breastfeeding would increase the risk to their pregnancy. Based on the way the mRNA vaccines work, there's no theoretical concerns that are known. And certainly there's plenty of evidence that having the infection when you're pregnant or not pregnant is a risk. So based on everything we know, based on the CDC information, based on other sources of information, there's just the evidence doesn't support, a higher risk from the COVID-19 vaccines to pregnant women or breastfeeding moms. And just so you know, in general, vaccines, even the live virus vaccines, at this point, the risks have been theoretical, except for maybe the yellow fever vaccine. I say maybe because that data is also very limited. But generally speaking, vaccines have not been a major source of risk to pregnant women. And on balance, when women have had even a live virus vaccine where there's theoretical concerns like MMR, there's just no evidence that even inadvertent exposure during pregnancy increases the risk for birth effects. The warning against live virus vaccines is always based on theoretical concerns, nothing that is actually known. So certainly we don't expect much different from the mRNA vaccines. And, we're in the news, so we're so happy that, some of our publications get picked up. As there's lots of misinformation that sometimes gets picked up and then disseminated, or information that's maybe very, provides a great headline, but really isn't very helpful to pregnant women. But it's really great when we're able to get our experts, like our director, Dr. Tina Chambers, out and able to talk to other folks, and actually get important messages out there to healthcare providers and the public, evidence-based information that is helpful to pregnant women and the public about COVID, as well as other infections that we're concerned about. And so really important that we're out there, and that we're grateful for all of this of the media that wants to seek the evidence-based information.
So I am Ashley, and I take care of the digital marketing for MotherToBaby California. And I'm going to go over the resources that we have for you and show you where they're located. So the MotherToBaby California website is at mothertobaby.org/California. We launched a new website with a new look, and it is mobile optimized. So it provides a really good user experience online. And to navigate the website, there are two different language options. One is English, and that's the default, and the other one is Spanish. So at the top of the navigation, how you navigate to the Spanish content is you use the drop down with the flag, and you select Spanish. So we're in process of fully transcribing the content fully in Spanish. So as a first-time user, it's really important to go to the homepage and then select the drop down to select the Spanish homepage and see the type of content that we have. So let me just scroll ahead. Our top section in the exposure area is the exposure area. And this is what houses our unique content that really helps individuals navigate exposure risks. So for example, if you click on the top tier, it will take you to an overview page for the section. It will provide you a tiled experience of our most popular exposure topics, and COVID-19 is at the top in orange. So once you click on the exposure of interest, it will take you to a page that aggregates all of the information on our website related to this topic. And it includes an introduction to the exposure written by our expert staff, a link to any ongoing studies, our fact sheets related to this exposure, baby blogs, podcasts, and any links to partners and any external resources that we recommend as a team. The second item listed in the exposure tab is our fact sheets. These are authored by mother-to-baby experts across the country, members of the nonprofit Scientific Society, and recognized leaders in teratology information. How you navigate this section is you use the accordion on that fact sheet page, or you can search within fact sheets for a specific exposure. And then from there, you can click in to the HTML page or quickly link to the PDF. And these are all in English as well as in Spanish. And the PDFs are print ready files, so you can easily print them and disseminate the information to anyone in your community. And this section right here is the next tab over that is titled Health Professionals. This section is not limited to healthcare professionals, but really in general, one of our major user groups are healthcare providers. But this is a central hub of information for anyone who's a professional or working at an organization. So the health professionals landing page, if you click on that first item, provides an overview of our content organized by specialty. So things from maternal fetal medicine specialist, OBGYN, neurology, all of these disciplines are organized in this section, very similar to how the exposure pages are set up. So a user would click on the tile and it would take them to a page which compiles all of the information on our website into a nice summary where you can then click on anything of interest and just really peruse our content. The second item listed in the HCP section is to refer a patient to our services. You don't need to be a health professional again to refer a patient, to refer a person to our information service or to our studies. This is the place that you would go to. And with the person's consent, you can fill out this form and select either exposure counseling if they need more information about a specific exposure and really an individualized risk assessment. You can also refer the person to one of our pregnancy studies. If an individual has a chronic health condition and is prescribed a medication, we monitor and study these individuals to see if there's any increased risk from taking medications as well as vaccines. So you can use this as a central hub to refer individuals to exposure counseling, study participation, or both. And the third item in the dropdown is to request patient education materials and provider resources. This is at no cost to you. They're printed professionally and shipped to your office. And this is what the page looks like. You can select the quantities using the arrows to the drop-down boxes to the right, and then navigate the different sections using the arrows. So the first default open drop-down is for the mother-to-baby information service, but we also have information related to our pregnancy studies and health professionals. And this is our most popular printed material. This is the mother-to-baby rat card. It provides an overview of our services, and it is English on one side and Spanish on the other. And it's written for pregnant and breastfeeding persons. And then on our MotherToBaby California homepage, it has our specific contact information. We're housed at the University of California, San Diego in the Department of Pediatrics in the Center for Better Beginnings. And it has a number of our unique email addresses. And then it also has a button on every single page of our website where a person, if they're interested in getting help, getting exposure information, they can use the live chat button to get this help. And our our live chat and our phone service and our email is open from 9 a.m. to 5 p.m. Pacific, Monday through Friday. And then there's also our contact tab on the website. And this is where you can find all of the information on how to contact our team, as well as in the upper navigation, we have our phone number listed. And part of a pilot project that we're doing this year is to see if visual infographics are successful at reaching new users. So if you're interested in receiving any of these exposure graphics, we have 3 that we have created, and they are a visual communication tool that talks about 3 of our most popular exposures: reproductive hazards in the workplace, nausea and vomiting in pregnancy, and COVID-19. And there's a QR code that will take the user directly to the fact sheet on this topic. And these are both in English and in Spanish. And then, like I mentioned, I am in charge of the social media for MotherToBaby California. This is a place that you could go to stay up to date on exposure information. We are on Facebook and Twitter as MotherToBaby CA, and on Instagram on our parent account at UCSD-CBB, which also contains other programs in our division at the center. And if you're interested in increasing communication with any pregnant or breastfeeding women that you serve, we're very interested in doing things like Facebook and Instagram live events with members of your staff. We could do interviews. We are also interested in gaining new partners and listing them on our website, but we also can do things like retweeting your content or posting on social media. But this is a really good place to really stay up to date with what we're doing, any events that we're attending, and any trending topics that are in the community, like if there's any local outbreaks of exposure risk. And with that, we'll go back to Marla.
All right, thank you, Ashley. So my part, as I said in the beginning, I'm the Community Outreach and Engagement Coordinator. So anything that has to do with any events that we participate, all the different types of fairs and festivals that are all on pause right now, but see what we can do right now virtually. Go ahead, Ashley. So we do partner with a lot of community organizations to further educate their staff or their clients about pregnancy and breastfeeding exposures. So we can do presentations about a specific exposure like alcohol in pregnancy, or a general presentation like this one to the different organizations. And like Ashley mentioned, we do collaborations on social media. We have information tables of the different fairs and festivals. And hopefully in the future, we can go back to our live events, and we'd love to participate with any of you guys at your events. So the education helps support healthier communities by reducing the risk of birth defects and other adverse outcomes for moms and babies. So here's just some snippets of some of the events that we've done. As you can see, our table there, the purple MotherToBaby California. We have our different displays. We also do, like I said, the presentations for specific groups. The one in the bottom corner there was specifically for attorneys regarding fetal alcohol spectrum disorders as a developmental disability. Here on the left bottom side here, we did our walk called 9 Months Matter, promoting alcohol-free pregnancies. So a variety of different events that we organize and participate in. And so we're always looking for better ways to serve our community. So our goal is to increase service to underserved populations, including Spanish-speaking communities throughout California. So we had an 8-week, Ashley was mentioning a pilot project. We put up a billboard in one of our local neighborhoods here in National City, California. And the billboard's in Spanish, and it's asking if this is safe during pregnancy and gives our contact information. So free and confidential information about chemicals, pesticides, and more, kind of reaching to the migrant community, the immigrant community. So that was one of our new pilot projects that we did. So the goal is obviously to reduce health disparities in the Latinx community. So our team is trained to assist the different communities and better understanding pregnancy and breastfeeding exposures. We do have a common exposure Spanish landing page where if you click on here, you can fill out a quick form to confidentially connect with one of the experts in either English or Spanish. And like I mentioned, we're establishing new partnerships all the time. So we're welcoming to new organizations. This is kind of a snapshot of some of our current local partners that we have. You can see the list here, and we're always hoping to add to that list. So if you are interested in a more specific partnership, you can definitely visit our partnership page, which will be here in the link that we'll send to you guys. You fill out a form, and then we can connect about talking about how we can partner, whether it's via social media, anything, hopefully in the future with events and things like that. So as we mentioned, we are with the Center for Better Beginnings, and we have a variety of programs that improve the health of moms and babies. MotherToBaby California is one of them. But we also have the Institute for Fetal Alcohol Spectrum Disorder Discovery, or IFAS for short. We have our Mommy's Milk program, which is a milk bank, not for sharing milk, but it's a human breast milk biorepository. So we collect breast milk samples and for research purposes. And then as Ashley and Sonia mentioned, we have our mother-to-baby pregnancy studies, which follow pregnant moms that have chronic conditions or that have taken certain medications or vaccines. And so all these programs are housed at the Center for Better Beginnings at UC San Diego. So here's our contact information. So myself and Sonia and Ashley are always available to talk to you guys about any of the stuff that we went over today. And we will be sending out an e-blast later with a link to the recording of the presentation so that you can share with maybe your colleagues that weren't able to make it. So that will be available to you guys.